also engage the general population in to take a holistic view of it.
And that's the next thing we're going to talk about.
Yeah.
But let's wrap this comorbidity thing up.
Yeah.
First of all, how many Ghanaians live with the pre-existing conditions that we have so far seen in COVID-19 deaths? The hypertension, the diabetes. Yeah. And so. Let's take hypertension.
Yeah.
What percentage of Ghanaians, to your knowledge, at the moment have hypertension?
Oh, could you let me say this?
You don't have the figures.
No, I don't have the figures.
That's all right.
You know, I've just come in from.
I appreciate that.
So I don't have
appreciate
the figures,
that.
So I'll not go there.
I appreciate that. We did a check, and we noted that in 2018, which is 2 years ago, it was 13.5% of Ghanaians who have already been diagnosed with hypertension. 11% of Ghanaians have already been diagnosed with diabetes.
Yes.
That's a large number. 11% of 30 million. That's a lot. That's a lot of people.
Yes.
And these are the people who are most at risk.
Yes.
So what's your advice here? Is there some messaging that should be going out to people with such conditions to keep them safer?
Oh, thank you very much. You see, now let me take you to the government's overall strategy, why we are here as in. You see, the first point that the president wanted the nation to actually know is how to limit and stop the importation of the cases. And to me, and following this, a mandatory quarantine center was set to mandatorily quarantine all travelers who came in before, after the ban was imposed, just the cutoff this thing. And what the president did was to avert a catastrophic or a potential catastrophic spread, because we certainly know that out of the 1,030, about 115 had positive or were positive. If that measure had not been taken, the spread was going to be, it was going to be too massive. And for that decision alone says that early detection or putting early measures in place is actually better. And that is exactly what the president did. And I think that has saved the nation of this catastrophic spread, that's a potential catastrophic spread that I am talking about.
Oh, Dr. Abuaji, I was asking what advice to give to people with pre-existing conditions. They are listening in to you right now.
Yes,
they are worried about COVID-19 because it is people like them who are dying. And I was asking, what advice should those of you managing this thing on our behalf be giving them to help them, reduce their chances of going, the unfortunate way? But all I'm hearing is what the president did.
Thank you so much. I think, you see, I'm just talking about the control measures in place.
Right.
How the control measures has helped. But also, more specifically, like the preventive etiquettes should be institutionalized. In fact, even if you look at what we are doing, we are looking at how to live in our homes to make sure that we do not get the virus, or even if we get it, how to prevent others from getting it. And this is why it is important that the wearing of the mask should be mandatory, and we shouldn't joke with it, because we certainly know that at least it protects you and the others from getting it. And also the social distancing, it is something that we should not really forget, because at the end of the day, when you are talking to someone, don't just go and stand in front of the person just to because if you move with the virus, and if you talk with the virus as well. So those are the things that the washing of hands should not also be taken for granted, because it is actually very important. But when you are sneezing and you are coughing, you also have to cover your mouth with tissue, and the disposal of the tissue is also very important. Make sure to put it in a bin where then you cover it appropriately.
Right.
Then I remember that the last speech of the president, he also added something which was also very good. how to boost your immune system by eating our local foods, like the contomerates, like the dawa dawa, yasantua, and all those foods. I think these are very important to help, and it's a very good advice for not only our elderly. We know that they are at risk, but they are at high risk, but everyone is also at risk.
Yeah.
So let's try to follow the preventive etiquette as we go on.
Thank you for that. Now, in a moment, we'll get into the big debate, how to live with COVID-19. But I'm going to get the thoughts of Dr. York on this. Just really quickly, Dr. York, are there, beyond the general things that we must do to protect all of us from this thing, those who have pre-existing conditions in Ghana, what exactly can they do extra to ensure that, they are a bit safer?
Production can sort that out.
I'm sorry? Hello,
yes,
Dr. York?
Yes, the line briefly went dead.
Yes,
so
we have you back now, yes.
Sure, that's correct. Great. So your question, please.
Yes, I'm wondering if, from the medical point of view, there is something that a person with a pre-existing condition can do to reduce their chances of, having a negative effect if they were to be infected with COVID-19.
Sure. I think I must underscore again that one of the risk factors for increased risk of death is also advanced age, and that we cannot do anything about. But the things we can do about is for us, even as the general public, to find out, especially those who are above 40 years, visit their doctors to check whether they even have some of these underlying conditions in the first place. And referring specifically to diabetes and hypertension, that's easily diagnosed. But for those of us who are aware, I think we should, be visiting our doctors to make sure that our numbers are right. Because one of the inherent risks, again, for increased death, apart from the underlying conditions itself, is that once your numbers are poor, especially diabetes, your risk of having a severe disease or death increases. And this current data that's coming from China and Europe and also America. So that numbers down, keeping the numbers down must be underscored. That would mean that once you also have your prescriptions by your doctor, you need to be compliant with your medications and keep your appointment. Sorry. Now, beyond these things, we need to stay healthy as well. I hear Dr. Bwadi talking about eating control and the like. I think that must be encouraged because diet, especially a balanced diet, makes us healthier and help prevent disease. And even when we get the disease, we tend to do better. There's a problem during this COVID era where a lot more people are staying home and reduce physical activities as a result. So what it means is that we need to cut down how much we eat. You may be eating the right quantity or mix, but then because you're also not exercising or having physical activities to match the energy intake, you are tending to put weight. And I've seen so many friends that has happened. Again, to our children as well, that is the situation we are observing. So physical exercising is important. Let's get out of our homes if we can. I know that the gyms may not be the right place now, but as individuals and living in smaller groups with our family, that should be a way to do. You don't need to be running. You can just do brisk walking, and for you to sweat for your heart, feel that your heart is beating, and then that should do. Beyond all these medical things and lifestyle measures, importantly, to underscore what we must do is to do what we've been told already about doing maintaining proper hand hygiene, maintaining social distance or appropriate physical distancing, and above all, let's use our face mask, live right, so that we don't get, contract the disease in the first place. For us to, possibly have worse outcomes. Or if you drive around, Kojo and the listener, I'm sure they can testify. It's as if nothing is happening. There's no COVID. People have gone back, to their usual way of life since the ban was lifted or the restrictions were relaxed. And I think that we must be reminded that the disease exists, is still ravaging society in and out Ghana, and therefore we must do what we've been told to do to prevent the spread of this condition.
Right. Very important points made there. I see you echo a lot of what Dr. Abuaje has also mentioned. Now, let me ask this. And this is the beginning of that debate, about how to live with COVID-19, now that it's become a reality for us. And you made an important point earlier about the fact that people have kind of started to already take it for granted. People have started to already operate as if it's just another thing in the background. And they are not being as careful as they were in the beginning. When we say it's time to figure out how to live with it, tell us from a medical point of view whether that means we should now get comfortable with it being there, or we should actually get more cautious. How do we then start to live with it? What are the implications medically for us?
Could you let me underscore this point again? 2002 there was an outbreak of SARS in China, and there was also MERS a couple of years ago. We have COVID now. And in all of these outbreaks or pandemics, what controlled the disease was maintaining physical distancing and wearing face masks. That is the only way, and that's the age-tested way of controlling such pandemics. That is transmitted human to human. So none of this debate that is happening now in Ghana, whether to relax, not to relax, we should live with it. I think we should never forget that whatever the final decisions will be from the government, those age-tested principles must remain. Maintaining physical distancing, and then the hand hygiene and the wearing of face masks that we've recently added. Now, should we? To what extent must we go? And I think that luckily for Africa and Ghana, the number of deaths we are seeing is relatively low compared to the Western world and China. And people, academia will discuss it, and we think that the relatively younger age group of this population is a factor, and the fact that overall the general population, these underlying comorbid conditions are not as high as you find in other places. If you go to Italy, the elderly were the most people that were dying. And if you look at the deaths that the Ministry of the Ghana Health Service published, it was quite prevalent among those about 40, 50, 60 years old. So, that again must be underscored in trying to formulate policies that will make sure that we live with it, yet we are not, increasing the spread. And what we are also praying for is that a vaccine is, developed so soon, so that that will help in our control. I know there's a debate about whether to open schools or not to open schools. It's a complex decision that the government or the president has to take. The economy must survive, yet we also know that if you open it up so quickly, there's also the health implications that is on the other side. How do we balance the two? And I guess that they must engage, the experts, the medical association, and all interested bodies to come to a reasonable compromise where we can still open the economy to an extent, yet preserving these things that I've talked about.
Okay, now you use a word that I'm very interested in, and that's compromise. And this is why I want to bring Dr. Abuaje back in. And perhaps this is the thought on which we can start to wrap up this whole idea of starting a debate. Compromise. We've heard the information minister talk about the government's plans to engage industry. Try and define between them what it will mean to completely reopen our society, how we would do it in a way that would be safe. And I hear about compromise, and I hear engage and discussion, and I'm finding it hard to put that alongside something which is a finite value. Yeah. COVID-19 will either infect you or it won't. If you do A, B, and C, it can't infect you. If you do D, E, and F, it can infect you. So if you are an employer, you own a factory or a business or a salon or whatever it is, you have a place where the public will be attending. There ought to be a certain minimum standard, oughtn't there? A minimum standard of safety. And if you cannot meet that minimum standard, you should not operate. Now, should that standard be defined through a discussion, through compromise? Is that how to do it? This is a health matter, a health and safety matter. Should we be having employers compromise that, we can provide hand sanitizers, but we can't provide soup? Or, we can let people stand at 1 meter distance to work, but we can't do 2 meters. And then government will listen to that and say, okay, we will compromise. It's a virus. It doesn't understand compromise. So why are we consulting? Why are we not simply prescribing a safety standard to which we must all operate? Dr. Abuaje.
Kojo, thank you. I think I want to explain something to you and your listeners. You see, in health, we talk about determinants of health. And in making decisions of this nature, you have to take a holistic assessment or view. Now, if you talk about the determinants of health, you are talking about the economic indicators. You are talking about the social indicators, housing, agric, transport, everything inclusive. So, and we also in health have what we call the health in all policies. So It means that in health, the transport must have health in it. Agric must have health, economic must have health, social must have health. So if you take this principle, then it means that when you want to take a decision on something that actually affects the health of the people, health outcomes, then it means that you also need the stakeholders' participation. So this is why the consultation is very important. In fact, to me, it may end up that, we will have, let's say, general rules for which majority of the stakeholders are doing. When I was coming in front of your station, you had a washing facility that I could wash my hand, and I did that. Then you checked my temperature. Then you see, so those are the things that we're talking about. But saying so, there could be some specific things that some things might have to do. For example, you say, if you want to allow churches to operate, how do they do it? So we want to engage them for them to, and also sometimes you have to engage them and explain to them so that when they bring their proposals, then you also guide them, because we are the technical people to be guiding them. You see, so I think that is what the Honorable Minister was talking about. So we want to start this conversation to have a holistic view of whatever is happening. Then we can now inform the government or the president to make decisions based on that. So the easing could be, let's say, even in phases. It could be, it depends. So it depends on the conversation that we have. Then a holistic view will be taken. Then we take it to who taxed us, to the person who taxed us to do it. So,
but to be clear, there are already prescribed safety procedures. For example, how far apart we should stand. That's already prescribed. It's set. So if employers come to you and say, let's say a nightclub owner comes to you and says, that's what WHO says, that's what Ghana Health Service says, but I can't do that. I can manage maybe half of that. Half of that puts people at risk. But will his opinion be considered in determining the final,
I think, you see, this is where I was talking about. You see, because you've submitted a proposal or because we've engaged you, it's not a guarantee to say that we have accepted what you put forward. But we are just saying that, yes, we want you to participate in the discussion. And that is what is up. So we want every Ghanaian to participate in it. Then
but their views may not be taken.
Well, it's not their view. You see, we cannot take all views. Certainly, we're going to have to. But what is the principle saying? And what is best fit for? So let's say, majority are saying that, as a general rule, let's make hand washing facilities. Let's put it in the vantage points or something. Then in that case, we weigh it and say, majority of the people were saying that this.
I want to say thank you to you, Dr. Abuaje, because you have started the conversation, and we will certainly keep it going. We appreciate your time with us today. Of course, Dr. Da Costa Abuaje is the Director of Health Promotion at the Ghana Health Service. Over the phone, we had Dr. Ernest York. Thank you to Dr. York. He's a leading endocrinologist and consultant physician at Kolebu Teaching Hospital. We appreciate you both. And indeed, may the conversations begin. More after these.
What would you do